Welcome to the video series on DHS Spatial Data and Geographic Resources. In this video, we will introduce you to the various spatial data and geographic resources offered by the Demographic and Health Surveys Program, or DHS for short. Since 1984, the DHS program has collected nationally representative data on fertility, family planning, maternal and child health, gender, HIV/AIDS, malaria, nutrition, and other topics in over 90 countries through more than 300 surveys. There are 4 types of surveys carried out by the DHS program. 3 of them are household-based: Demographic and Health Surveys, or DHS, Malaria Indicator Surveys, or MIS, and AIDS Indicator Surveys, or AIS. The 4th is health facility-based and is called the Service Provision Assessment, or SPA. The DHS program provides data users with numerous spatial data resources for beginners through to advanced users of Geographic Information Systems, or GIS. These resources can be used to map the survey indicators and better understand spatial patterns in health and demographics in a country or in the world. In this video, we will introduce you to these resources by presenting definitions of DHS program terms, ways to make basic maps, the GIS Training Curriculum, the Spatial Data Repository, and the GPS Datasets. To begin, let's review some of the key terms and features of the survey methods that the DHS program uses. DHS survey samples are designed to give representative indicator estimates both at national and at subnational levels. For sampling purposes, countries are divided into survey regions. These regions are subnational units that usually correspond to existing administrative units, such as states or provinces, or maybe groupings of these units, as is the case with Region 7 in this example. From each of the regions, enumeration areas, or primary sampling units called clusters, are randomly selected to get a representative estimate for that region. Within each cluster, a number of households are randomly selected for inclusion in the survey, and information is collected about each selected household and the individuals within it. The SPA survey is also sampled to have representative regions, but the sampling units are health facilities instead of households. Sometimes it can be useful to quickly generate a map to compare indicators visually across countries or regions. Let's look at some ways to make maps with DHS program data. In StatCompiler, an online data visualization and mapping tool, you can create and export a map of your chosen indicator at either the national or subnational level for a single country or a group of countries. Within the web interface, there are various options for modifying the format of your map and for exporting it as an image or a shapefile. The DHS program's mobile app also allows you to view some of the most common indicators as maps, using either national or subnational data. Although most of the features of the app work offline, to use the mapping function, you'll need to be connected to a Wi-Fi or cellular network. The Spatial Data Repository is an online resource that allows users to explore geographically linked data from the DHS program. The Boundaries page allows you to see a summary of survey regions for a specific country. You can download the region boundaries for each of that country's surveys in shapefile format, or view the region boundaries on a map. By using the Compare Boundaries tool, you can view the regions for 2 surveys side by side and see how boundaries have changed over time. On the Data page, you can download indicator data linked with the boundaries files that you can use to make maps in your own GIS software. After choosing which country or countries to download, and whether you would like to download the most commonly used indicators or a selection of your own, the data you choose will be included in the attribute tables of the files, which you can then download in either a shapefile or geodatabase format. On the Gallery page, you can browse maps that have been created using data shared on the SDR site. You can even submit your own work to be featured in the gallery. Other useful information is available in the Methodology and Resources tabs. If you are new to GIS and want to learn some of the basics, the DHS program, along with our partners at Measure Evaluation, have developed a GIS training curriculum. The curriculum is available for download from the Resources page of the Spatial Data Repository website. The curriculum uses QGIS, a free, user-friendly, open-source GIS program. Now let's look at the DHS program GPS Datasets. In most household-based surveys since 2000, field teams collect the latitude and longitude coordinates of each surveyed cluster. To date, the DHS program has georeferenced more than 61,000 survey cluster locations. In service provision assessment surveys since 2009, the coordinates for the locations of health facilities are also publicly released. These coordinates are made available to the public and can be linked to individual records in the DHS household or facility survey datasets. The GPS dataset comes in the form of a shapefile. They give the coordinates of the locations of the survey clusters or health facilities and can be analyzed in a GIS software package. The geographic datasets must be requested separately from the main data files. Your project profile must describe why you need the geographic files and how they will be used in your project. Some of the information that the DHS program household surveys collect from respondents is very sensitive and needs to be kept confidential. It is important that no one uses the GPS data to identify the individuals who are interviewed. The DHS program protects the confidentiality of the respondents of household surveys in two ways. First, only the coordinates of the center points of clusters are used, not the locations of individual households. Second, the cluster coordinates from household surveys are displaced. This means that they are randomly shifted to a new location under set parameters before the data is publicly released. Urban clusters are displaced at a random angle and a random distance up to 2 kilometers. Rural clusters are displaced at a random angle and a random distance up to 5 kilometers, with a further, randomly selected 1% of the rural clusters displaced at a distance of up to 10 kilometers. The coordinates of health facilities in SPA surveys are not displaced because the information collected in SPA surveys is different from the household surveys. The DHS program household survey displacement process minimizes the risk of disclosure. However, it also introduces error that can make the results of a spatial analysis less precise. For more information about our geographic displacement procedure and how to account for it in your analysis, you can consult the DHS program's website or reports numbers 7 and 8 in our Spatial Analysis Reports series. This concludes this video on the DHS program's spatial data and geographic resources. Check our YouTube channel for more informative videos about how to use the DHS program's data and resources.